But I've got some pictures of of a lecture I went to, no, a conference I went to, and there's a patient there. He was a gentleman, a businessman, very erudite. He got up on stage and he spoke about his basal cell carcinoma. And of course,
common skin cancer in Australia,
skin cancer on the forehead,
and in the UK.
Yeah, it came back in the lymph nodes, and it was operated on, and of course disappeared for a little while. Then it came back with a vengeance, and it didn't take long for a big ulcer to form in the neck and penetrate, and it was penetrating the carotid artery, and this poor man. He was doing everything because he lost faith in the medical profession. And the carotid artery started to weep blood. And the surgeons said, we can't operate on this. It'll be too friable, as you know. So that's the end. And he had, I hope I'm allowed to tell stories like this because...
Emphatically you are. Yeah, you're not breaching any confidentiality. It's brilliant.
No.
Yes.
No, I know. I mean, I know you like evidence, but this is this is. A case
This is evidence from a highly experienced physician of his patients. That is evidence.
Yeah. Well, it started leaking. He had some friends who said, "You've got to try this." So they gave him. He did a few vitamins and that sort of thing, and he had been doing that, but nothing was really working to heal it. So he started taking huge quantities of cannabis by mouth orally. He started smoking it as well, and he got some compresses with the cannabis paste out of just
like a poultice effect.
Yes. Put it on, and there. When you have a look at my Dropbox, in fact, I think I mentioned it on that talk I did in India. If I sent you that link. You see this massive ulcer like this with all of the necrotic material and the artery bleeding, just shrinking up and healing. Unbelievable.
I mean, can we explain this in terms of a modulation of an inflammatory process effect? I'm just thinking about cancers generally. So, I mean, anything where you get chronic inflammation, cancer becomes a risk, doesn't it?
Absolutely.
And if these CBD type receptors on the immune cells, is that having like an immunomodulatory effect? Is that your thinking?
Well, remember, John, at the beginning we talked about the endocannabinoid system and receptors being on every cell in the body. So the receptors are on every cell in that wound. Skin cells, the dermal cells, the epidermal cells, the nerve cells, the muscle cells, all the connective tissues, the white blood cells, not the red blood cells, the white blood cells, killer cells, the T4, T8 cells, all of them have got these receptors. And so they're all talking to one another and they're all communicating. It's like what we should be doing as human beings.
Good idea. Yeah.
But it's
potentially affecting every tissue in the wound. Yes.
And I don't know how much cleaning of the wound, but when you have a look at it, there was a lot of debris in the wound. And when you've got a fungating lesion like this, it's just
horrible.
It's horrible to look at, and you don't want to go anywhere near it. But this gentleman survived, and he was there, and he showed the scar that was left. He was open and honest and I think that's the most dramatic thing I have seen in terms of physical healing in a patient. So
if you need to give CBD and THC together, that's often just for a short period of time, maybe a day or a week or what? How long? Well, what I want to avoid is the THC feeling. How long would I have to put up with that?
Oh, look, you don't have to put up with it at all, John. If it's in the oil, the only effect is you might feel a little high, or you might feel a little drowsy, it's not going to make you feel silly. You feel good with it.
Well, our sincere thanks to Professor Ian Brighthope. Now, we actually had a bit of technical difficulty on that and we lost the signal, but please just accept that as a taster, because we plan on doing much more with Professor Brighthope, both in terms of CBD and therapeutic cannabis, but also he's a specialist in various other aspects of natural medicine. So we're hoping to tap his expertise to benefit the world health, basically. So for now, sorry, that's all you're getting, but more to come as soon as we can get it sorted out. But for now, thank you.